Thank you. Yeah. So I'm talking about antimicrobial resistance, AMR. That's quite a mouthful as well. Not only my business card. But how does that relate to the EAT agenda? Because it does relate to what we put in our mouth, what we have on our plates, and how it gets to the plates, as Gunhild said this morning. It is about nutrition and food. It is about agriculture and how we produce. It is about sustainable development. And of course, it is about health. So, and what the link is really because, as we know, antibiotics are used as growth promoters in several parts of the world. Maybe unnecessary so. And many says that that is necessary because we need more meat. We need more meat to feed the increasing populations. But the other answer is that we can reduce the demand for meat, is a part of the agenda of EAT. So that's, I would say, why AMR, or antimicrobial resistance, fits on the agenda of EAT. The Nordics are in the green zone. You see the map here indicating that the Nordic countries is in a prime position. We have a low problem of resistance in the Nordic countries compared to the rest of Europe and most parts of the world. We also have a low consumption of antibiotics, both in our healthcare systems and in our agriculture production systems. So we are in a positive situation. But we have increasing trends here as well. We see now increasing rates of resistance among our patients. These are increasing MRSA, one of the bacteria that are resistant in our hospitals. They are increasing in our permanent populations and citizens, but are increasing even more so among our immigrants. And that's because our immigrants come, of course, from the rest of the world, where the problem is higher and more of a challenge. Antibiotics is really a cornerstone of medicine, a cornerstone of modern medicine. Of course, we all know that it can be used to treat infections. But it's also important for around deliveries, if you need complex deliveries. And it's really key to do modern operations, transplants, and others in medicine. It's really a wonder drug. And it makes wonders every day in our healthcare systems. If we cannot turn the tide on antimicrobial resistance, the recent report led by Lord O'Neill from the UK, the Secretary in the Treasury, has indicated that we will have 10 million additional deaths every year in the world by 2050. Those 10 million additional deaths will first and foremost be not in our parts of the world. They will be in, of course, the most populous areas in Asia and also in Africa. It also has an economic consequence. If we add up the economic costs of increasing resistance, it has been calculated by the same report that it will add up to $100 trillion by 2050. And that's a large number. And I've looked at it, and it's 700 times the Norwegian annual national budget. 700 times the Norwegian annual budget. I see this as, we can call it a bathtub problem, because we need to see and treat antibiotics as a resource, a common resource we need to preserve. It's not a natural resource, it's a human-made resource. So we need to renew it by innovation. We need to actually come up with new drugs, new medicines, new antibiotics. But when their effectiveness is reduced due to resistance, and the balance between new antibiotics coming onto the market and those becoming ineffective due to resistance is not right, the water level sinks. And that's the situation we are in currently. The water level is sinking. How can we solve this challenge, we can, of course, try to reduce the demand for antibiotics. And we should do that, definitely. We should do that because it's the best thing to do. That is about having proper sanitation systems, having proper systems for hygiene and water, introducing and using vaccines, securing that we have good infection prevention measures, and of course, that we treat our animals in our food production systems the way we should treat them. So that will reduce demand, but it doesn't help. The water level will still sink at a slower rate. To really solve this problem, we need to bring many sectors and many actors together. And we need to start with one important goal, and that is, first and foremost, to secure access of antibiotics or antimicrobials to those who need them. Today, more people die from lack of access to affordable, available antibiotics than those who die because they are ineffective due to resistance. And if we don't solve this as a part of the problem, we will never solve the big problem. And we know that antibiotics has really contributed tremendously to some of the MDGs, in particular reducing mother and child deaths rates. So access is a starting point, but we need to combine that by stronger measures to conserve antibiotics as a resource. We need to conserve them through different measures by using them more responsible. And we need to secure innovation. So we need to have 3 common policy goals at the same time and need to combine them. Because if we have access without conservation, that will just speed resistance and we will lose the effectiveness. If we really start conservation and stricter control, it will undermine access and innovation, and many will die without access. And if we start now increasing incentives for innovation without tackling the problem of conservation and access, there will be an unjust situation, and the innovation in resources we invest, they will be wasted far too early. So this is a wicked problem. That's why it belongs here at the EAT Forum, because we need to break down silos across sectors. Because just based on what I've said now, this is a healthcare system challenge. It's a public health and infrastructure issue. It's related to innovation and manufacture of pharmaceuticals. It's related to food production and consumption and the type of consumption we use. It's related to environmental contamination because antibiotics can leak out from companies producing them, and it's a health security issue. So we need to combine health policy, industrial policy, agricultural, regional, environmental, development, and foreign policy.